Hello everyone, I welcome you all today on my channel. As you all must be well aware of by now that what is going to be happening today. So we have the privilege to have with us NEET PG AIR 01 as well as INICT May 2022 AIR 13, Dr. Shagun Batra ma'am herself from MAMC. And it's a great privilege ma'am to have you on this platform, and we are very thankful that you have taken out time to guide the juniors as well.
Thank you, Akshat. Thank you so much. And it's my pleasure to be here.
Yes, ma'am. So heartiest congratulations. Like we all must be well aware of what feeling that you are having right now. And everyone must really, aspire hard to be at your place. And it's such a phenomenal result. So again, heartiest congratulations.
Thank you.
So those of you who are watching this video, I want to mention that timestamps of everything is mentioned in the description. The concept of this video is कि NEET PG preparation is not something which you can start it off at particular time. It is something कि आप first day से आपके concepts अच्छे से करते हैं from in whichever year you are, and at the end maybe in internship or final year you can funnel it down. So we will keep that lot in mind, and ma'am हमें बताएंगी कि MBBS फर्स्ट ईयर से लेके फाइनल ईयर तक क्या एक आइडियल टाइमलाइन होना चाहिए, व्हाट यू कैन डू, because obviously what she has followed is now the ideal timeline, and also it's not possible for every one of us to fit in that zone. So even if you have not followed this, तो आप आखिरी में उसको कैसे changes कर सकते हैं, कुछ smart tricks जिससे you can again have a good result in your hands. So let's start with the video. So ma'am, the first question which I would like to start is that what do you think is the ideal target or journey for a first year MBBS student to think about NEET PG?
So firstly, my journey was not ideal. I have made a lot of mistakes myself, but I've learned from my mistakes and I've corrected them. So everybody makes mistakes. It's okay. In my first year, so see, the pattern has changed a lot now. At that time, I didn't even know about the existence of NEET PG. I thought NEET UG ho gaya. Like everybody used to say, कि एक बार NEET UG कर लो तो ऐसे ऐसे, but they couldn't be more wrong. So in my first year also, I was really chill. I enjoyed a lot. I used to study before tests or exams, and we used to go out almost every day, and we explored Delhi so much. So at that time, I didn't really think of entrances much. And if NEET PG was the same now as well, I wouldn't recommend anybody else to think. But with next and everything, and with the uncertainty that is around it, so you can start to think about MCQs and entrances at that time, but it should never compromise with your textbooks. So what I used to read in my first year was I had one foreign author book and I had one exam type Indian book. So for anatomy, I had Snell's, and I also had Netter's and Beckmore's Atlas, and obviously BDC for exams. And for physio, I had Guyton and Girong both. Like in my first year, I read Guyton because it was easier at that time. But Genong is actually a better book. So after I was over my first year, I read the entire Genong for a quiz. So if you have to read one book and if you can read Genong, you should definitely go for Genong. And we also had our HOD's book, Dr. A.K. Jain, for exams. Similarly, for biochemistry, I had Harper, and for exams, Dr. S.K. Gupta sir's book, he was our HOD. So at that time, anatomy was my favorite subject. I loved it and I studied it very well. But I hated biochemistry, like totally hated it. I mean, till the time I started reading it for entrances, I had kind of an aversion towards biochemistry. I used to think, why is this subject in MBBS? But so I think that is one thing that I would have gone back and changed in time about first year. So for an ideal thing for a first year student as of now, focus on your textbooks. That should be your priority, but don't forget to have fun, because first year is first year. Like entrances are far away right now. Don't really think you just give an entrance. Don't stress yourself out too much. Focus on your textbooks. If you have time left, you can combine your textbook learning with MCQs, but they should never substitute your standard textbooks.
Right. So definitely, guys. So the crux of the entire thing is that MBBS first year should be more of a balance between enjoyment as well as exploring the standard books of MBBS. That basically medical literature सिर्फ 300 MCQ, 200 MCQ से नहीं होता है. So you need to be well oriented in your entire preparation. And जो भी next का होगा uncertainty, तो वो सबके साथ होगा. तो आप उसकी tension अभी से मत लीजिए. So right. So ma'am, now what should be the once a first year student comes to second year, then entire environment changes, हर कोई कुछ ना कुछ preparation start कर देता है. So what could be the ideal target for a second year MBBS student?
Okay, so again, starting with my journey. So the MBBS was different back then. I think third to fifth semester. Now it's changed. Some like forensic has also been removed and all. So third semester is supposed to be the honeymoon period of MBBS. So we had I didn't care much about studies then. I participated in all fests and all. Fourth semester was actually the time when I started studying seriously. So I had joined Dr. GRG sir's live classes. And I think they were the best thing that happened to my preparation, because that was when I started studying regularly. Usually I just used to study for tests, but sir had tests every week, and then there were grand tests every month or so, and there was a platinum test. So that was something that inculcated the regular habit in me. So I am really, really thankful to him, and he has that magic of making pharmacology really fun and lucid. And another thing about second year is, if you can only read one standard textbook in the entire MBBS, it should be Robbins, because Robbins is like a gold mine for MCQs as well as knowledge. So never skip Robbins. Don't take any other book for it. It's not like you can't pass without reading Robbins, but then point nahi hai. And then in fourth and fifth semester, I obviously gave priority to my college exams and my textbooks over MCQ. Even at that time, I didn't really, well, I knew, by that time, I knew about the existence of an exam that hoga ek PG exam hoga. But, and I used to solve a few MCQs, and because I had to solve MCQs for GRG sir's test. So that was all, but I didn't really start a very targeted preparation. So for now, for a second year student right now, again, there is a rumor of next one being at the end of first year, second year. So again, your textbook should be the priority, and have a little less fun than first year. Have fun, obviously, a little less. Be serious, because the second year subjects actually form the crux of your subjects ahead. And if you get time, you should definitely do it. And don't try to study the third or fourth year subjects in second year. Just keep it to first or second year.
Right, definitely, ma'am. So like ma'am said, so let me tell you everyone that Dr. GRG sir, as ma'am told, live classes. So basically, yes, if you are from Delhi, you can obviously attend the live classes. But if you are someone who is not from Delhi or can't go there, so sir also teaches on Prep Letter app. So again, on there, you can, like ma'am told that in the classes, they had weekly test and all. So try to build up your own system. Like maybe you can also watch some video lectures, and after that, कि एक unit हो जाए तो उसके बाद आप खुद test दे दो. So it will make you feel like you are having some targets and all. So obviously focus on Robbins as well, and pharma mein, क्योंकि there is a lot of learning and you need to know how to study it in a proper manner. So you can surely check out GRG sir's video. Now I'm in second year, particularly microbiology is very, something which is very volatile, be it for internships or be it in second year itself. So any particular, resources or how you utilize, especially in internship?
So I used Dr. Shagun sir's notes. He teaches in Prep Ladder. I didn't read them in the second year, but they were my resource for during internship. And it's like they're very comprehensive, and there are a lot of mnemonics, and it covers almost every MCQ. Like there is rarely anything that is left out of it, and it's not like it is too bulky. They're very thin notes, but they have everything. So they're concise and very helpful.
Right. So definitely, ma'am, thank you so much for suggesting the targets for MBBS second year student. So till now, if you are first or second year, focus on your books and finish first, second year subject. Don't rush to the third year subject. So now, ma'am, let's start with the core, जहाँ से preparation सबकी almost start होती है third year, final year. So what could be the ideal target third year? एक तो ये चीज, और दूसरा final year के subject third year में करना चाहिए. अगर parallelly करना है तो किन subject पे ज़्यादा focus किया जाए, and how should be the approach?
So yeah, definitely, because third year in my time there were only three subjects. I think forensic medicine is in third year now, but it's not that big a subject anyway. So in third year you have a lot of time, because ENT are not that big subjects, and PSM is anyway Bhagwan Bharose. So in theory exams at least. So you have a lot of time and you should utilize it well. In my third year, I made notes for third year subjects as well as final year subjects. So I read the third year subjects along with my textbooks, obviously, but for the final year subjects, I only read the textbooks for whatever, if I had medicine posting or surgery posting. So I was only reading the relevant parts. Like I was not trying to cover the entire final year syllabus in my third year. I only kept it limited to clinical learning and notes. So in third year, your notes should be ready. Even if you don't revise them, but they should be ready.
Okay, right. So, then when did you approach properly final year subject? What was the strategy for that?
Yeah. So I approached the final year subjects in final year itself. So I had actually mapped out my entire schedule for final year, but unfortunately COVID came right at the beginning of my final year. So we were all sent home. And at that time, it was very difficult to plan anything because we never knew when it's going to end. There was no definite end point. Like I could only make short-term targets ki is week mein itna kar sakte, because I couldn't really think ki kab khatam hoga and stuff. Right. So in final year, I read all the final year subjects very well, all 9 subjects, not just the 4 core subjects. And I even read textbooks. It's not like I read Harrison, I read Dailies, I read Tatta and Ghai. So it was all very selective learning. I didn't read those textbooks cover to cover, but I supplemented the books with the notes, and that was really helpful. Also, since it was COVID and we were at home, I had some extra time, so I finished my first and second year notes during that time. Okay. So by the end of my final year, I had like 19 subject notes ready.
Right. So definitely, ma'am. So one thing, like COVID happened at the time of your final year. So right now, if a student is in say third year, so what would be your advice? Because maybe in final year, if they will have their offline classes, so covering entire 9 subjects with standard textbook maybe get difficult for some student. So in third year, they also have forensic medicine as of now. So do you think that medicine का कुछ portion या surgery का कुछ portion third year में they can either start doing or something like that? कुछ parallelly चलाना चाहिए?
Definitely. Like along with PSM, also you can do something like infectious diseases is something that is a big part of PSM, and it's a part of medicine as well. It's also part of micro, so you can integrate all that. And while you're doing that, Obs Gynae is I think one subject which can be finished completely in 30. Like I saw that bigger subject. Medicine and surgery are big subjects, I agree. So you can do some part of medicine, some part of surgery, either along with your college lectures or along with your postings. And you can complete Obs Gynae and Peds because they're not that big subjects, and short subjects as well. But if you're not able to do short subjects, it's okay. You can do them in final year, but try to complete at least Obs Gynae and Peds and some part of medicine and surgery.
Right. Definitely, ma'am. Sure. And also regarding the books, like you said, studying Harrison's or Bailey. So this is something which, nowadays is going a lot of, lacking out of fashion. Yeah. Bus notes, or usually students are very confused कि कहाँ से पढ़ना है. So उसका क्या part, how would you suggest the selective learning वाला thing?
See, once you attend lectures, once you attend classes, you automatically realize what topics are important, like what they're teaching from. Even in this NEET, there were so many images that were directly picked up from Bailey, like same images. So if you read those books, you don't really, you have an edge over others. I know सबको ऐसा लगता है कि notes तो easy है, मतलब same ही तो चीज लिखी है, but then reading textbooks gives you another kind of thinking. You read between the lines, you get a different sort of understanding. So I think this is not a good trend that people are leaving out textbooks. Obviously, easy way तो सबको पसंद ही आता है. But for certain topics, you should, because in PG, you'll have to read textbooks anyway, even in life further. So you need to get that habit of reading textbooks, because notes are patient तो चार option नहीं लेके आएगा अपने साथ कि please doctor tell me मुझे ABCD में से क्या है. So you need to develop those skills, those learning, that approach towards the topic.
Right. Definitely, ma'am. So this is something very important for everyone to learn. So now the crux is that you should ideally enjoy your MBBS with the teaching, with the learning in such a manner कि हम doctor बन रहे. And now when it comes to internship, you can obviously get some sort of shortcut, you can say, to get the good result in your PG entrances. So now coming to the most important topic, suppose internship में ma'am there are many subjects like pharma. Okay, you prepared GRG sir's note by then. Micro you revised from Sonu Pawar sir's. So anything else like internship में how you approached, and this should I think maybe start with some of your grand test and question bank and attempting something like that, strategies for internship.
Okay, so even in my internship, at the very beginning of my internship, since I knew my schedule, I planned that what subject am I going to do in what time. Like I had some hectic postings, I had some lighter posting, and that's the same with everybody. So the bigger subjects like medicine, surgery, or anatomy, pharma, etc. I planned them during my lighter postings, and suppose ENT or stuff forensic in my hectic postings, so I don't break the momentum. So for every subject, I used to first read the notes, and simultaneously along with that, I used to sort of QBank. See, QBank is not something that you can really take out time with. You should do it whenever you get time. You're going to the you're going in the metro, you're going to collect a report, or you're just waiting for something. Just open your phone. You have that boon of having it like it's so accessible for you. So QBank simultaneously along with notes, and after that, then I used to give a test for that specific subject, and so then I used to consider that subject completed. I did that for every subject, and when I was suppose in the mid of my preparation, see my internship started in May, so I started giving grant tests seriously around October, November, and since then I gave all my grant tests like regularly. Initially once a month, and as the exam got closer, twice a month or once a week.
Right.
So grant tests are extremely important. Like you can study everything, you can do all questions, but if you don't simulate the exam environment, it's not. You will fumble in the real exam, and you might have a breakdown.
Right, definitely, ma'am. So this particular concept of starting grant test. So this is again, which is a very trend which is going in a good manner. So but nowadays, I receive also queries from say MBBS third year students ki hum grant test start kar de kya dena, right? So that one thing that you said कि seriously देना आपने अक्टूबर नवंबर से start किया, maybe उसके पहले आपने कुछ attempts किए हो, तो like वो जो seriously वाला एक जो point है जिस पे आप emphasis मतलब कि once how much syllabus should be completed कि you should give, नहीं तो ऐसा भी नहीं हो कि एक subject अभी बस third year, second year, first year आता है and you start giving it. So what should be that thing कि seriously देना मतलब once and all subjects get completed या उसको कैसे approach करना है?
नहीं, ऐसा तो कभी वेट नहीं करना होता है कि all subjects get completed, because even after the exam all subjects will never get completed completely. Like syllabus कभी खत्म नहीं हो सकता है. So see, when you're done with final year, you have read all 19 subjects at least once. चाहे notes नहीं पढ़े, कुछ तो पढ़ा है. You have some idea. So once you know what your weak subjects are or volatile subjects are, you can do them in the first 2-3 months, and then you start giving grant tests. You can't wait for the entire syllabus to get over. Right. That way, so you will give one grant test, and that will be the real exam.
Right. Definitely. Sure. So, ma'am, like many students, have this thing of university exams versus PG exams. मतलब they think कि या तो वो university में ही अच्छा कर सकते हैं, subjective के हिसाब से पढ़ के ही कैसे लिखना है, या उनको लगता है कि objective is something very different from what they are reading in general. So, what would be your take on this and how to balance this particular thing?
See, this is not true. I have been a gold medalist in all of my professional years, and I did pretty well in NEET PG as well. So obviously it's not true. I see, if you've done well in your university exams, that means you have had good concepts, because these theory exams actually test the clarity of your thought. Obviously, entrance exams test more knowledge, but clarity of your thought and how you present it is something that is tested in theory exams. So if you have your concepts right, you can excel in both. During your MBBS, you should focus on your professionals more. And during your internship, you obviously don't have to read any standard textbooks, and you only have to see, the thing is, once your concepts are good, you can eliminate what is not the correct option. But if you just cram up things, you know what the right answer is. And I think both are equally important.
Right. Definitely, ma'am. So that's the main, importance of studying those standard books, yeah, whatever. So like, ma'am, on the similar note, standard books versus coaching materials. So like for maybe there are some subjects which you think, like final year में particularly 4 subjects के अलावा जो 5 shorter subjects हैं, तो maybe उनमें standard books या such books student नहीं भी पढ़ पाते हैं, exam के time पे कुछ पढ़ पाते हैं, तो उनका particularly वो 5 short subjects के लिए if you would suggest something कि कहाँ से करें या कैसे करें, something like that.
See, except for orthopedics I really don't consider as a short subject, because even in our college, ortho had a very big weightage in surgery exams. So ortho ke liye you should read a textbook. We used to read Mohindra or Maheshwari, either of them. For the other 4 subjects, notes are more than enough. You don't need to read any textbook.
Right. ठीक है. So ऑर्थो आपने सिर्फ मतलब महेश्वरी कुछ something notes or something out of that?
And I used Apoorv sir's notes like Platte पे Apoorv Mehra sir है उनके notes use किए.
ठीक है. Fine. So now, so this is, I guess, an entire journey of first year to internship, right? We discussed. So again, this is something that, you know, whoever is watching this in whatever stage you are, प्लीज डोंट फील डिप्रेस्ड कि मैंने तो अभी तक स्टैंडर्ड बुक्स नहीं पढ़ी है या मेरा बिल्कुल अप्रोच का पैटर्न बिल्कुल अलग है. ऑब्वियसली एवरीवन हैव देयर डिफरेंट सेट ऑफ यू नो चैलेंजेस एंड व्हाटएवर दे नीड टू ओवरकम, बट व्हाटएवर स्टेज यू आर, आप यहाँ से जितना अच्छा कर सकते हो, यू शुड फोकस मोर ऑन दैट पर्टिकुलर थिंग. सो मैम, राइट, यू नो इट्स वेरी हेक्टिक इन द एंटायर जर्नी, से फ्रॉम फर्स्ट ईयर टू internship. So what are some of the ways of relaxation? This is not something very academic, but yeah, maybe आपने कैसे, and आपके टाइम पे तो स्पेशली अगेन पोस्टपोनमेंट्स भी काफी वापस से आया था इश्यूज, तो हाउ यू मेंटेन योर काम एंड यू केप्ट गोइंग? मतलब इवन इफ यू नो INICT में लाइक AIR 13 आने के बाद हो सकता है कई लोग सोचे कि यार अब नीट पीजी में एक हफ्ता है तो यू नो थोड़ा एक डिस्टर्बेंस आता है, तो हाउ यू केप्ट गोइंग इंस्टेड ऑफ ऑल दैट?
See, to be very honest, between INICT and NEET, I didn't study anything, like barely anything, because I knew that I'll get a seat. So I didn't really want to stress it, and I was done. Like I was totally saturated. So I went into NEET with like a very chill attitude. I didn't study anything on the day of the exam, and even on the night before, I slept around 8 or 9. So because I think that actually worked in my favor. So for relaxation during MBBS and internship. So in MBBS, so like I had a very, very nice group of friends. We used to go out a lot and they were all very supportive. And we used to play badminton. We also played basketball and used to go out for movies. And we have, like I've explored Delhi more. I've lived in Delhi all my life, but I've explored Delhi more in the last 5.5 years. And I did like 17, 18 years before that. During internship, since everybody had different schedules, it was very difficult to match our postings with theirs. So Netflix and Amazon became my good pals. So I gave enough time to relax, like, you know, because I knew that if I keep studying, I'll burn out. So it's like every time I used to eat, I used to watch something, and after 1 hour or so, I used to take a break and I would say go for a walk, because I was studying in my college at that time. So you would just run into people, you will have conversations. I used to talk to my family. I think it is recovery and relaxation are a very key part of your preparation. Like they're as important as studying.
Right. So guys, I think the main, you know, lesson from this particular talk right now is the first thing you need to always, you know, have a believe in yourself, that like ma'am, you know, build that concept right from her first year. So even last 1 week, she did not studied much regarding NEET PG, but still, you know, the result, right? So this is one thing that you need to always believe कि आप जो भी लंबे रन तक करते हैं, it always pays off. ऐसा नहीं है कि you might be thinking कि यार मतलब कई लोगों का होता है, like I also receive such queries कि मैं पढ़ती हूँ इतना ज्यादा, बट या तो यूनिवर्सिटी में नंबर नहीं आते फर्स्ट ईयर में, तो वहीं से उनका वो ट्रैक छूट जाता है. वो बोलते हैं कि सर दूसरा दोस्त है वो तो शॉर्टकट यूज करके मेरे से ज्यादा नंबर ला पा रहा है. सो दिस इज नॉट अबाउट समथिंग लाइक दैट. यू नीड टू ऑलवेज बिलीव कि व्हाटएवर you are doing it well. Right. So now on the, you know, fun part, we would like to have a short rapid fire round with ma'am. So this is something which is not academic. So I guess this could be a fun experience. So ma'am, you have to answer all these questions within a minute. Right. So first question, your worst Viva experience in medical school?
So I had this one Viva in PSM. So that the professor was very notorious for troubling students. Like I had prepared really well and I had written my case down very well. But then when I went in, he just started talking about politics and governance and, you know, religion and very controversial topics. So, and his thoughts were not like very opposite to mine. So I was just shut during the entire thing because I knew that if I say anything, that it's going to backfire on me. So I just kept nodding and I didn't say anything during the Viva. Like there was one Viva in which I didn't say anything. And I don't know how I passed, but I did.
Right. So staying silent also pays off in the Viva. So what would be the one thing you would like to do differently if you are, say, first year MBBS student?
In my first year, I would like to give more love and time to my relationship with biochemistry, because I had a very bad experience with it. So I wish I gave more attention to it. And apart from that, I don't regret anything. Like, I had a lot of fun. I studied less, but it was all worth it.
Great, great. So, ma'am, did you fail in any internal terminal examination in medical school?
Yeah, there is only one exam that I have failed in the entire MBBS. So it was a fourth semester medicine exam. So at that time, medicine was not an important subject for us because we were in second year, and our seniors told us that nobody checks these papers, and you just have to sit and you will pass. So that's all I did. I just sat for it and I just wrote anything. But then, like when I saw the result, I was like, "What is this?" I failed. It was marginal. It wasn't that much. And then for some time, I felt like, "How can I fail?" Because I never failed in my entire life. So, but then after that, I went out to celebrate the fail.
Right. So MBBS आपको वो सब दिखाता है जो आपने कभी सोचा भी नहीं. Right.
Yeah.
So, ma'am, your hobbies as such, one thing we can surely figure out is having fun with friends. So, other hobbies as such.
Yeah. I like playing badminton. I also like gardening. Like, we even built a small garden in our hostel, and I like traveling a lot. I went on 2 trips recently only. I also like learning new languages. I know German, and I'm currently learning French, and next is Spanish.
Oh, that's really great. So, मतलब I guess 19 subjects के साथ साथ 19 अभी मैम का
target, new target.
Right. So, any place you want to or you are going to visit after NEET results?
So I already did. I visited Dalhousie in Himachal Pradesh, and I also that was fun trip, and I went to Kashmir also with my family. Right now, I'm waiting for the counseling schedule so that I can plan my next trip.
Right, definitely. That's again another uncertainty. So, what's your favorite food?
Ice cream.
Ice cream, right? So,
yeah,
ice cream, right? So, what's something you are tired of?
I'm tired of answering my relatives कि MBBS एक subject में नहीं होता है. Like, I'm not specializing in MBBS, and that हाँ MBBS में बहुत मतलब medicine में बहुत लंबी पढ़ाई है, and हाँ मैं शादी कर लूँगी. I am tired of answering all these questions.
Right. Even after AIR1, they are still wondering about.
Yeah. Yeah.
Right. And I guess nowadays you must also be tired of answering questions for everyone. कि मैम मेरे लिए strategy बना दो, मेरे लिए strategy बना दो. I guess.
Yeah, I know. Like, I feel happy that even if I'm able to help a single person, it'll be like something very nice for me.
Right. Sure, ma'am. What's the one thing you learned the hard way?
I learned that there are some things that are not in your control, no matter how hard you try. And sometimes you just have to accept things as they are. Also, that people have a lot of battles that they're fighting, which you can't see. So you should be as kind to everybody as possible.
Right. That's great. So, your favorite movie?
So my favorite movie is Forrest Gump. And if I have to tell about a Bollywood movie, I like Queen.
Okay, right. अब Forrest Gump का Bollywood remake भी आ रहा है लाल सिंह चड्ढा.
I know, but I don't want to watch it. I don't want to spoil Forrest Gump for myself.
Right. So the most non-topper moment of AIR1, like एक तो आपका medicine का वो जो हुआ वो, and anything else, maybe from the school times or any time.
I've had a lot of non-topper moments. Like, my friends and my batchmates know plenty of them. So I've bunked classes also. I've been kicked out of lectures also, and I've been late very often. And I've crawled like a quadruped from the back gate into the class. So I've done a lot of these things, but I'm proud of them. It's okay.
Right. So I guess we had a great rapid fire round as well. And I guess ma'am excelled in that particularly really well. So we would like to, at the end ask some message for MBBS students in maybe some short sentences that what you would like to, convey.
So I would like to say that have fun, but be disciplined, and take risks, but be prepared for any consequences that come with it. And chase your goals, but don't bring anybody down in that process. And always strive to be better, but embrace who you are as of now as well. And every time that you're in boards or lecture theaters or clinics anywhere, you should be curious. You should have that why thing in your mind. And why is this happening? Because it will go a long way. And believe in yourself, because if you don't believe in yourself, nobody else will. And lastly, I think that these are the most important days of your life, and they will be over before you realize it. They are over for me, and I miss them very much. So don't like, it's important obviously to plan and study for the future, but don't forget to live in the moment.
Right. So thank you so much, ma'am. Thank you again for your time and this wonderful session. So I guess in this candid talk, students must be well connected. The toppers are not something which they are very different. Yeah, they study very differently. It's obviously you need to prioritize what you are aiming for, and मजे भी करना है, but साथ साथ जब जरूरत पड़े तब serious भी हो जाना है. So again, this is a very great talk, I guess, and students would like to, ma'am, have you keep guiding us. Maybe after 3 years down the line, when you are for some exam, उसमें भी आप AIR1 लाते, so we'll again have this interview. So thank you so much for your time again, and I guess you all must have learned something from this interview as well. And if you still have any queries, you can surely comment or connect with us on Instagram. So thank you, ma'am, and it was a pleasure talking to you.
Thank you, Akshat. Thank you so much for having me here.
Yes, ma'am.